going to demonstrate how to prepare regular insulin, which is short-acting insulin, and NPH insulin, which is intermediate-acting insulin, in one syringe. Insulin can be ordered by the generic name or the trade name. One brand of insulin must never be substituted for another unless it is approved by the primary healthcare provider, because some patients may be sensitive to changes in brands of insulin and never substitute one type of insulin for another. For example, do not use insulin zinc suspension instead of the prescribed protamine zinc insulin. When we administer insulin, we must be very careful. Insulin names and packages are similar and can be easily confused. We must read all labels carefully before preparing any insulin and always check the expiration date. Insulin must be administered by the parenteral route, usually the subcutaneous route, and not the oral route, because insulin is a protein and is readily destroyed in the GI tract. The only insulin preparation given intravenously is regular insulin, and it is given 30 to 60 minutes before a meal to achieve optimal results. Insulin aspart is given immediately before a meal within 5 to 10 minutes of beginning a meal. Insulin lispro is given 15 minutes before a meal or immediately after a meal. Insulin glargine is given subcutaneously once a day at bedtime, and insulin glargine can never be mixed with another insulin. If the patient is to receive regular insulin and NPH insulin, clarify with the primary healthcare provider first whether two separate injections should be given or if they can be mixed in the same syringe. If the two insulins are going to be given in the same syringe, the short-acting insulin, which is the regular insulin, is drawn first. Before I start, I check the order, and I am to give 20 units of regular insulin and 40 units of the NPH insulin. Before I start, I wash my hands really good, and I gently rotate the NPH vial to mix well. You should never shake the vial. Okay. Now I open the tops of the vials. Okay, I'm gonna open the syringe package. And I'm going to wipe the top of the vials with an alcohol swab. See? I uncap the syringe carefully. Now I withdraw. I'm going to draw 40 units of air into the NPH insulin. And now I'm going to draw 20 units of air into the regular insulin. Now I'm gonna flip the vial and withdraw 20 units of the short-acting insulin. Now I check that I have the right amount which is 20 units. So here I have 20 units. Now I withdraw 40 units from the NPH, and I should have 60 units of insulin total, because 20 plus 40 is 60. Okay, and I have 60 units total. It is very important to be accurate when measuring any insulin preparation. If you make an error on the measurement, you throw away the syringe and start all over again. I'm going to recap the needle, very careful. You should always have a second nurse independently check medication and dosage again before administering the insulin. After I withdraw the 2 insulins, I should have 60 units, which I already checked. I have 60 units of insulin in the syringe. Now I'm ready to administer the insulin to the client. Insulin can be injected into the arms, thighs, abdomen, or buttocks. It is important to rotate sites of injection to prevent lipodystrophy. After I administer the injection, the insulin to the patient, I properly dispose of the syringe and wash my hands, and then I'm done.